I'd like to start us off to introduce to you Karen Reissmann, who many of you might already know, who's going to be talking about the campaign in her hospital and in her health authority in the Save Bolton A&E campaign, but also talking about the Greater Manchester Review, so-called, called Healthier Together. Karen Reissmann.
Thanks very much. I want to start by saying I do think that the health service is probably under more serious threat than it's ever been since it was created. And that's for a combination of reasons linked partly to the wholesale privatisation and business model that's now being operated within the health service. But that's combined with the biggest set of cuts that we have ever seen in the history of the health service. And those two things combined are making the health service change into something, without even being declared that those changes are being made, into something that isn't the National Health Service as we know it. For anybody who works in the health service, they'll know that there is virtually no recruitment going on in the health service at all. There is virtually no trust that is taking on anybody. I googled mental health jobs in Greater Manchester on the NHS jobs website before I came here. There is one mental health job being advertised in the whole of Greater Manchester. I googled nursing jobs in Greater Manchester, and there were 39 nursing jobs being advertised across the whole of Greater Manchester, which currently employs over 15,000 nurses. There are 39 jobs, of which 12 are bank and agency. And that's not a surprise. Every trust is facing huge financial constraints, which means they are cutting down on staffing as well as everything else. In some trusts, like the one up in Bolton, they are making drastic cuts. So they have now issued a formal redundancy notice saying that they intend to make 500 full-time equivalent staff, so that's more in practice of real people, staff redundant within the next 3 months. And that means that every department, they're saying, for 20% of non-clinical staff will lose their job and 15% of clinical staff will lose their job. Amazingly, they are arguing that 500 staff not working in Bolton will have no impact on patient care whatsoever. And to be honest, there's a bit of me that just thinks, I don't quite know how they think they can say that. That is more than 10% of the workforce. And to say that you can take those 500 staff out without it affecting is just ludicrous. And I don't want to particularly talk about doctors, nurses and therapists, because I think it seems fairly obvious that you couldn't lose those without it affecting care. But there's been quite a snide, nasty attack on the other parts of the health worker team who are not clinical workers, and an assumption that somehow if they disappear that won't make a difference. So I want to give a couple of examples. For example, the switchboard. You want to ring the hospital, find out when your appointment is, find out when your results are, find out whether you're going to have a bed that morning to be admitted, all the things that we ring hospitals for. In Bolton, there will be 2 members of the switchboard between 9 and 5 for the whole hospital. And outside those hours, there will be 1 member. And they deal with all the emergency heart attack calls within the hospital as well, all the fire alarm calls, all the security calls, on top of the telephone calls that you make when you come in. I don't think that's going to affect patient care that you do that. Medical secretaries. Medical secretaries, you think, what does it matter if, the doctor has to wait a little bit longer for something? But if you go to hospital and you see a clinician and they say you need to change your care, and then that letter goes to your GP and it doesn't go for a week or 2 weeks or 3 weeks or 4 weeks, and your care's not changed, and currently in Bolton they have people waiting a long time for those letters to be received, your care will be compromised because you won't be getting the right treatment, and potentially that can affect your care. And the union representatives at Bolton have said absolutely clearly, patient care will be compromised by cutting 500 staff. And that's why they have taken a position of not just saying that if 500 people want to go voluntarily and give up their job, as long as it's not a compulsory redundancy, that's okay. And there are unions in the past who might have taken that position. But I think we in Bolton have been quite clear that if you allow jobs to go, then you allow the service to be threatened, you allow patient care to deteriorate, and when it deteriorates, then it has an impact on the people that you want to ally with to save your service, and it has an impact on those of us who are left, who are expected to do 2, 3 or 4 people's jobs. But that's the scale that some of the attacks in the health service are now at. And in the health service, we've actually not implemented the cuts as quickly as they have in other public services. They reckon less than 5% of NHS cuts have been implemented so far, and there is a 95% still more to come. So what's happening in Bolton today will be happening in other trusts up and down the country and across Manchester in the weeks, months and the year or two to come. This is not an exception. This is something that is driven by the £20 billion worth of cuts that are now being expected of our health service to make, despite this government being elected on the basis of no top-down reorganisations, which is a complete joke, and no NHS cuts, which is also, it would be a joke if it wasn't so tragic for the people who are being affected. And on top of that, they're clearly asking health service workers to make cuts in their living standards, and there's a tax on our pay. We've had a pay freeze for 3 years, we've had a tax on our pensions, where we've lost a day's pay in a month in order to contribute the extra to a pension that's worth less. And there's also huge-scale rationing going on in the health service now, something that never existed in the past. So, for example, if you're diabetic, you used to get your toenails cut by a chiropodist, because if you make a mistake, then you risk having your, it going septic, and because you've got diabetes, the chance of you getting gangrene and having your leg removed is very high. So for the cost of a small amount of preventative care, right, they risk something quite expensive on their point if you're doing a money sum, but on a personal sum, you risk losing your leg for the sake of a small amount of cut in chiropody. Those sort of cuts of rationing of what you're allowed to have and what you're not allowed to have is happening all the time by what were PCTs and what are now GP clinical commissioning groups, and you're not being told about those cuts that are taking place. This is not a public debate, but things you get less and less and less, and you're told by clinicians this is just what you can do now, this is all we're allowed to do. But despite those cuts, despite the job losses, despite the attacks on our wages, that will not be enough to cut the £20 billion that they need to cut. And therefore, the other thing that they're now considering on a whole scale, that they're definitely considering in Manchester, but actually is a national policy, is looking at the whole model of healthcare that we have taken for granted. I'll read you a quote from the Greater Manchester Healthier Together proposals. And it says, "The way our health service has evolved with a hospital in each borough was designed to meet the needs of the last century and is no longer appropriate. The NHS spending in Greater Manchester of £6 billion a year is not sustainable given the financial challenges, and too great a proportion of our resources are spent on acute care and unavoidable crisis. The current model of care are not fit for the challenge of delivery, given the scale of planned reduction in spending." And what they're arguing is that the idea of having a hospital in every borough that we've got used to, we have a local hospital, is no longer financially sustainable. And there is a programme called Healthier Together, which is due to report in Manchester in about a month's time, in Greater Manchester, that will argue for a reduction in the number of hospitals, for a centralisation of a whole number of services, and they will get some doctors to stand up and say this will provide better care for people, to have less A&Es, but the A&Es that you have will be in bigger hospitals that will have every specialist on duty all the time, 24 hours a day. And for the minority of people who actually need those specialist services to be available, then that might be an asset. But for the majority, and there has been some research that shows 90% of people with life-threatening illnesses do not need all those specialists available, they will lose out. And I do think that that threat to the hospitals that we have, lots of people I know, when we've been campaigning in Bolton, have said they can't possibly close Bolton A&E. It's busy all the time. You think it is busy all the time, but that will not stop them closing it. They say you can't close the whole hospital. Where would people in Bolton go? I'd just say look at Rochdale. Rochdale downgraded its A&E from a full A&E to a part-time A&E. It is now, Rochdale has no inpatient beds, has no A&E, it has a walk-in centre, and it has some outpatient appointments and some diagnostic tests for the whole of Rochdale. So you think you live in Littleborough, the far end of Rochdale, you have to travel miles to get to Oldham or to North Manchester or to Bury, some of which are also under threat under the circumstances that they have. So there are huge, huge threats, and those threats will risk people's lives. There's been some research done that shows for every 10 miles that you have to travel to an accident and emergency department, you have a 20% extra chance of dying as a result of travelling that 10 miles. So if any of the district general hospitals close in Manchester, it's likely that the people who live in the areas where they close will have a 20% extra chance of dying when they get there. And I think that I suppose I want to end with the stuff about our opportunity to oppose what's going on, because I think that's all very depressing. And to be honest, working in Bolton at the moment, it is very, very depressing going to meeting after meeting and telling staff, you might be made redundant, they need to cut 20% of your department, will you be the one, or do you want to all volunteer to take a cut? Or it's depressing to do. But at the same time, I think we need to be confident that the people in Britain are actually very, very sort of bound to the NHS. The NHS is probably the institution in Britain that people feel most fond of and are least willing to allow to be sacrificed. When Bolton's A&E was first threatened, we launched a petition, and within less than 10 weeks, we had 30,000 signatures on that petition, which I think is an astounding number of people to have done it. And that's because it went viral. We were just every day there was envelopes coming in the post. We didn't even know who they were from, saying here's a pile more petitions with signatures on. And I think that reflects the public's desire to defend the health service that we need to mobilise. But also, I think that health workers want to defend the health service. I didn't choose to work in the health service because it was just another job. I actually wanted to do something where I felt I could help people. The sort of staffing levels that they're now asking people to work at, and we've seen the Stafford report into Mid Staffordshire Hospital, where they put money as a priority to become a foundation trust. Between 400 and 1,200 extra people died over the course of a few years because that trust put finances as a priority. They now are asking every single trust in England, and it is in England, interestingly, Scotland and Wales don't have the same, so it doesn't have to be like this, but they're asking every trust in England to put money as a priority and to balance your books, and if you don't, we'll send monitor in, and if you don't do what monitor says, we'll take you over or close you down. They risk turning every one of us into a Mid Staffordshire, where 400 to 1,200 extra people will die in the course of a few years, where when health workers raise complaints, we're not listened to. And we've seen that, over the years of people not being listened to, and it has to stop. And I do think we have an ability to mobilise health workers who do want to do something about it. And in a way, they need to feel confident that the community is supporting them. And often when community campaigns happen, it encourages and gives confidence to health workers to feel that we can do something about it. And we have to look at how to combine those fights. But the other thing we need to do is we need to look how to combine the fight so that each hospital isn't left fighting on their own, because it feels much harder when you're left fighting on your own. And I think that idea of people coming together today, I think this is a really, really encouraging conference, looking at the breadth of people here, of where people have come from, and their willingness to take a day out of a weekend to come and talk about this, to look at how we can begin to link those fights up. And that might be a Greater Manchester-wide demonstration. I know in London they're planning a demonstration in mid-May, and they have asked whether we might want to go with one on the same day, to look at maybe beginning to create a nationwide day of action over the health service where we have sort of, regional demonstrations in defence of all the attacks that we're facing together. But we have a responsibility to do that. And the other thing I think we have to do is where workers do fight back, people might know in mid-Yorkshire, Dewsbury, Pontefract, Halifax, that they have been on strike against cuts in the admin and clerical service, precisely the medical record staff who mean your GP doesn't know what your consultant wants to change in your medicine. Those staff are being cut and downgraded, and they've been out on strike. We need to make sure when they and other people go on strike that they get a solidarity. Even a solidarity message makes a difference. If people want their email address, I can give it them. It's easy. It's midyorksunison@aol.co.uk. So it's a relatively straightforward one. But people should send a message of support, even if it's in a personal capacity. They should invite people to their union meetings, because health workers don't always feel confident about fighting, and they're more likely to fight if they know they've got support. And you asking them to come and speak or sending a message makes a huge difference. But I do think that the motivation of people in England is strong. I think we can fight this. I think we can win, but we have to get organised. And this is a fantastic start, but we have to build on it. Thanks a lot for coming.